welcome to Didactics Online explanatory video for the Spencer technique. This is Brandon Parker. I have Rob Cowie helping me out and Megan O'Connor behind the camera. We're going to be going over the Spencer technique, which is a 7-step technique that you can use for diagnosis to find any restrictions in the shoulder, as well as treatment if you can add any articulatory or muscle energy treatment to it. So I'm going to have Rob lay down for me. Now what I'm treating right here is his left shoulder. So he's laying down on his right side. What I want to do is lock out that joint so I have only motion right here at the glenohumeral joint. First step for the Spencer technique is extension of the shoulder with flexion of the elbow. Now right here I'll just get into the treatment aspect that you can do on any step. So right here, if I find a restricted barrier, what I want to do is add either an articulatory, where I just try to work through it, or I can add a muscle energy. So there'll be an isometric contraction, so go ahead and push towards my hand and relax, and then I'll engage that next barrier. So that's the first step. Next step, we have flexion at that joint with extension of the elbow. The steps after that, there are 2 steps that involve circumduction. So that's just working through the intra-articular area. First step, I'm pushing down. So just working through that joint. If I find any restrictions, I can kind of work through that. After that, I'm going to go into traction with circumduction. I like to hold right here in case there's any elbow pathologies, but you can also hold up here at the wrist if you find that easier. And again, traction and circumduction. The steps following that, keep your hand right here and then put the patient's hand just proximal to your elbow. First step now is going to be abduction and internal rotation, again looking for any restrictions, adduction and external rotation, followed by adduction and internal rotation. A little pearl here is that as you're looking for any restrictions in this joint, you don't want to apply too much force because that can hurt the shoulder. So what I do, my rule of thumb is just 2 fingers, and that amount of force is about as much as you need. And then if there's any restriction, just go ahead and push against me and relax, and I can move it to that next barrier. After that, I'm bringing the arm up into abduction and extension and putting his hand on my shoulder. Now the steps for all of the Spencer technique don't necessarily matter what order you do it in. If you just want to focus on one type of motion, you can do that. But whenever you're finishing up the Spencer, this should be the last step, because what you're able to do here is mobilize any of the fluid that you may have released and really make sure you milk out that joint and make sure that you have some good fluid motion. So what you want to do here is just kind of work through that joint, make sure you're mobilizing any intra-articular fluid. And what I like to do is just walk up and down, so I'm varying the degrees of abduction in that glenohumeral joint. Thank you very much for watching. If you have any questions, please join us on this video or didacticsonline.com.